Oh, it looks like I have a long wait. I should have brought a laptop with me.
Hi. My name is Amir. I am here to see Dr. Kleiman.
Hi. Do you have an appointment with Dr. Kleiman?
No, I'm here to discuss business opportunities. He asked me to meet him here today at 3 p.m.
Please have a seat and I will let the doctor know that you are here.
Thank you. Diana. Such a surprise. What are you doing here?
Hi, Amir. I am so happy to see you. I came to see Dr. Kleiman. You?
I am happy to see you too. I am here to see Dr. Kleiman as well. I would like to discuss some business opportunity with him.
Interesting. I was about to call you, but the opportunity presented itself. I know you have a lot of experience in the healthcare industry, and also being an attorney you might have different views and insights on the new healthcare reform.
Sure, Diana, I would love to discuss this with you.
There is a long wait. I would love to conduct some sort of interview, if you do not mind.
Of course not. Go for it.
Let's start with the basics. Why do we need a healthcare reform?
Based on U.S. Census Bureau, 2008, in America today, approximately 37 million people do not have insurance, and these numbers continue to grow. Individuals without insurance have poorer health status and are less likely to seek preventive care.
Well, the individuals without insurance can and do get care by going to hospital emergency rooms.
That's true, but they're using the most costly setting for healthcare delivery. Moreover, these costs are passed on to other payers, driving up healthcare premiums. In addition to the lack of continuity of care for these patients, misses opportunities for ongoing chronic care management, and results in poor health outcomes.
So, if healthcare reform is needed, why so much dissension?
In my opinion, there are several issues. First, the difference of opinion on whether healthcare is a right or a service. The second issue, is it a cost issue or a fundamental weakness in the structure of the healthcare industry? The third issue, is government the best agent of change and should intervene in the marketplace or not? The fourth issue, is the choice only between Obamacare and status quo?
Interesting.
If you would like, I can unpack each issue.
Maybe later.
Rose Rodriguez.
Yes.
Hi, my name is Dr. Kleiman. Please come with me.
I understand that our new healthcare law will have a profound impact on the health and economic well-being of American families, businesses, and the economy. Can you highlight the key provisions of the new legislation?
Absolutely. Let me summarize first and then I can unveil each item if you want me to.
Great.
First is to ensure that all Americans have access to quality, affordable health care. Second, create a new, regulated marketplace where consumers can purchase affordable health care. Third, extend much-needed relief to small businesses. Fourth, improve Medicare by helping seniors and people with disabilities afford their prescription drugs. Fifth, prohibit denials of coverage based on pre-existing conditions. Sixth, limit out-of-pocket costs so that Americans have security and peace of mind. 7. Help young adults by requiring insurers to allow old dependents to remain on their parents' plan until age 26. 8. Expand Medicaid to millions of low-income Americans. 9. Provide sliding scale subsidies to make insurance premiums affordable. 10. Hold insurance companies accountable for how our healthcare dollars are spent. 11. Clamp down on insurance company abuses. Finally, invest in preventive care.
Wow, it's a lot to cover. Let me narrow it down a little. Can you please go over regulated marketplaces will help consumers find affordable care? In my opinion, the current insurance market is confusing and overwhelming. There is no one state or federal entity that regulates all markets. Nor is there much regulation on what information insurers must provide to consumers. Therefore, it is often difficult for consumers to know what exactly they are getting under each plan, until it's too late. How will the new reform address this?
Health reform will address these problems with the creation of newly regulated marketplaces known as state-based exchanges. These new marketplaces will provide consumers with information to enable them to choose wisely among different health plans. Premium and cost-sharing subsidies will be available to make coverage more affordable.
So, you are saying that insurers in these marketplaces will be required to provide health plan information in an easy-to-understand format, online and in other ways, so that consumers will be able to understand and compare plans. If I understood it correctly, the idea is that by encouraging consumers to compare the benefits of all plans before choosing one, insurers will compete for business, ultimately giving consumers better plans at lower prices.
Yes, that is correct. Each exchange will be state-based, but the law allows flexibility in how states choose to run them. States are required to have these exchanges up and running by 2014. But many states are starting to lay the groundwork now for their own state exchanges. For example, Massachusetts already has a fully functioning insurance exchange, and Oregon recently created the Oregon Health Authority to implement healthcare reform legislation.
Let's discuss the idea that insurance companies can no longer deny coverage.
Insurance companies will no longer be able to turn down Americans for coverage based on their pre-existing condition, health status, gender or age. Within the first 6 months of enactment, insurance companies will no longer be able to discriminate against children with pre-existing conditions. And by 2014 they will be prohibited from refusing coverage to anyone based on their medical history or health status. Until then, the federal government will provide insurance for those with pre-existing conditions through a national high-risk pool. Or they will provide federal dollars to already established state high-risk pools to allow them to take in more participants.
I see.
I am really sorry. I overheard your conversation. Would you mind if I ask you a question?
Not at all.
What about coverage for young adults?
I see. What's your name?
Alex.
How old are you?
24.
Under health reform, people like you, who are dubbed Young Invincible, will now be able to stay on their parents' insurance plans until they are 26. This allows for young adults to start careers, move, and take risks without the threat of debt.
Oh, thank you. Alex Rosenbaum, yes.
Would you mind if I also ask you a question?
No, not at all. Please do.
What about the new and improved Medicaid?
Currently, you must have a low income to be eligible for Medicaid. But you also have to meet other requirements, like being a child, a pregnant woman, or a person with a disability. In most states, if you are an adult that does not have dependent children, you cannot qualify for Medicaid, no matter how low your income. Currently, in 42 states, adults without dependent children are not allowed to enroll in Medicaid, even if they are penniless.
Yes, I know that. What about new healthcare reform?
Health reform brings relief to millions of these low-income Americans by requiring states to expand Medicaid to include everyone with income up to 133% of poverty by 2014. Other than those age 65 and up, most of whom are eligible for Medicare. An estimated 16 million people will enroll in Medicaid over the next decade because of this expansion. This represents an enormous accomplishment, but also presents an enormous opportunity to streamline and simplify the Medicaid enrollment process to ensure that all low-income Americans get the assistance they need.
What about holding insurance companies accountable? the insurance companies seem to have no problem jacking up rates, regardless of whether they are really necessary or how these increases will affect those who depend on their insurance. That is not to say that premium increases are always unjustified, but the current system doesn't offer a lot of protection for consumers against companies that raise premiums, only to spend that additional money on marketing and profits.
Health reform changes the way insurance companies do business. First off, the new law establishes national medical loss ratio requirements to help regulate how insurance companies spend our premiums. Now companies in the large group market will have to spend 85% of premium dollars on medical care and quality improvements. And companies in the small and individual markets will have to spend 80%. That means insurance companies will spend the majority of our premiums on actually keeping us healthy. And if companies have money left over, they will have to return it to beneficiaries. That may seem like a no-brainer to us. But this is the first time that we've had a national standard to ensure that companies use premium dollars to pay for health care.
Joanna Smith.
Yes.
Excellent discussion.
I am sorry, but I also would love to ask you a question.
Of course.
What about improving Medicare?
An excellent question. The health reform debate produced a lot of misinformation about how the health reform bill would change Medicare. Much of it focused on false claims of cuts to benefits, the infamous death panels, or hurting granny. First of all, closes the donut hole. Currently, Medicare's prescription program, Medicare Part D, has a gap in coverage. This gap is commonly referred to as the donut hole.
Can you please explain how does the donut hole work?
Well, for example, my father has several medications that he needs to take every day to keep his blood pressure down, to treat his diabetes, or to relieve pain from arthritis. With Medicare Part D, he pays a deductible, and then 25% for the cost of these drugs until the total costs of the prescriptions reach a certain level. This payment structure is typical, but some plans charge flat copayments instead of a deductible and 25%. Then, he enters the donut hole, where he has to pay 100% of the cost of his drugs even though he's already paying premiums.
Yes, I have to do the same.
The health reform legislation shrinks the donut hole over time. In 2010, people in the donut hole should have received a $250 rebate. And starting in 2011, they would get a 50% discount on brand-name drugs and other discounts on generics. These discounts will increase each year until the donut hole is eliminated by 2020.
That is great.
In addition to, with health reform, preventive services for those with Medicare will be free. Medicare will also finally cover an annual wellness visit, basically an annual physical, which will encourage beneficiaries to visit their doctors to talk about staying well instead of just making appointments when they get sick.
I see.
And finally, without reform, it was projected that Medicare would have insufficient funds as early as 2017. Reform extends the life of Medicare by nearly 10 years without cutting any of beneficiaries' guaranteed benefits.
Thank you. I really appreciate your input.
Ms. Zelenkova.
Yes.
Amir, can you please briefly go over the timeline what need to be done and when?
Sure. This year focus will be on improving quality and lowering costs by improving preventive health coverage and expanding authority to bundle payments, in addition to increasing access to affordable care by increasing Medicaid payments for primary care doctors and providing additional funding for the Children's Health Insurance Program.
And in 2014?
Prohibiting discrimination due to pre-existing conditions or gender. Eliminating annual limits on insurance coverage. And ensuring coverage for individuals participating in clinical trials. Also, making care more affordable. Establishing the health insurance marketplace. increasing the small business tax credit.
Diana,
I guess it's me. Thank you so much, and I'll call you if I have additional questions.
Sure. Nice seeing you, Diana. Good luck.
Thanks.